Kagan. I'm an internist, and I'm on staff at St. Joseph's Hospital in Burbank.
And I'm Patty Kagan, and I am a nurse educator at Providence Hospital.
And Patty and I have done international healthcare for a number of years. When the earthquake occurred in Port-au-Prince, Haiti in January of 2010, people we had worked with went to work for a field hospital that was established 30 miles east of Port-au-Prince. And 1 week after the quake, Patty and I went there as well. But before we left, we got in touch with the sisters
Sister Colleen.
Sister Colleen specifically, and told her where we were going and asked if there was any way they could help us out with supplies. And we were just overwhelmed when the response was essentially, the doors to the cupboards are open and help yourselves, whatever you need. And we ended up bringing over 150 pounds of antibiotics to a field hospital, along with IV tubing and IV fluids. And they were very, very much needed. It was a post-op tent of 35 patients that Patty was in charge of.
Well, what I was going to also say was we came back, and then a week and a half later went back down again to the same field hospital, and once again asked Providence if they could give us some supplies. And what was really needed at that time was the IV fluid. They were down to not having any normal saline, which is the primary IV fluid that you give any ill patient or recovering patient. And when we arrived back at the field hospital after having come home with just 100 pounds, 250-pound bags of IV fluids, I mean, we were like the king and queen, because we were bringing what was really, really needed at that time. Working for Providence has been wonderful. It has really helped to make possible going to do charity work wherever it is, whether it was 5 years post-Katrina on the anniversary where we did free clinics down there, or going back to the Haitian-Dominican border. They totally support the time taken off and support us doing it. And it's just wonderful to work for a nonprofit that really does live the mission.
And I would say that the commitment of the sisters has always been there to serve as the core of what it's been like to work at this hospital. And by the core, I mean their mission to take care of patients and to do what is best for patients has always been first and foremost.
Sorry about that.
Hello. I am Sister Colleen Suttles, and I'm the Chief Mission Integration Officer for Southern California. I have been very fortunate to be part of the Providence International Missions Committee. So I travel to Seattle all the time to plan for international missions. But a few years ago I was able to join the Southern California cohort to go to El Salvador and to look at what was going on in El Salvador, this role of the Sisters of Providence as they worked in El Salvador, and to do some light medical care for the patients there. But it was very awe-inspiring to see what the sisters have been doing down there, and that we are a part of that. But more to my heart has been our work with the people of Mexico, the people of Tijuana. 9 years ago, we started taking leadership members to Tijuana to work with an organization called Esperanza. Esperanza in Spanish means, or in English, means hope. And this organization works at helping the poor of Tijuana build their own homes. They do have jobs, they have some money, but they have no way of getting a home because the population keeps burgeoning. It is a huge population, and there's no place for them to live without a home. So we go down every year with our leadership team, and we help these families build their concrete homes. we do the sweat equity. We make the cement and pour the concrete, and we learn how to work with the people of Mexico in that process. We also look at the healthcare issues and some of the immigration issues that they are dealing with. It changes the hearts and the minds of our leaders when they see what conditions the people of Mexico live in, but yet how happy they are because they have their families with them. The hardest part of that trip is when we go to Casa del Migrante and see men who have been separated from their families because of immigration issues. As a person who has responsibility for our mission, we know that we take incredibly good care of people who come to us. But there are many people beyond our borders who also are in need of care. We know we can't meet all of the needs of the people of this world, but when we go beyond our borders, it changes us so that we are able to meet that mission of revealing God's love for all, not just those who live in the geographic boundaries of our community. This year, we are starting a new project with Providence, and we are happy that it is initiating in Southern California, where we are taking our first surgical team to Guatemala. There are 4 surgeons and 4 anesthesiologists, and the whole surgery team will be going down for a week to Guatemala to provide free surgery for individuals who would never have access to that type of care. Our physicians, our staffs are giving of their own time, of their own PTO time, to go down and to form a Providence community, helping the people beyond our boundaries.
Hi, my name is Christian Bassa. I'm a black belt here at St. Joseph's. I've been here for 18 months. What makes Providence special to me is its commitment to its core values, particularly the core values of compassion. Providence has a program here called Providence Health International that helps employees reach out across the borders and help in areas of great need. Last Christmas I had a chance to do that and work with Providence Health International in Cambodia. I had a chance to serve in a free hospital there and work in a clinical laboratory area, which is very much similar to some of the projects I've been doing here at St. Joe's. The experience was definitely eye-opening and humbling in a lot of ways. Just seeing a different world and different needs altogether, and remind me how fortunate I am to be here in the U.S. But I think also just how important it was for me to be a part of a company that really cared about reaching the needs of those who are really poor and vulnerable. The fact that Providence has a program like Providence Health International is important to me, and it tells me how much they value really the core values that they've had from the beginning of just reaching out to those who are needy, and I think that makes it very special for me to be here.